People say they don't have time. And the reality is, if you don't have time for fitness, then how do you think you're going to have time for sickness? I think that we have a muscle crisis, not an obesity crisis. And that's why I do what I do. Is I do what I do because if you have a capacity to protect people, you have an obligation to do it.
Gabrielle, in the health and wellness space these days, there's a ton of focus on losing weight. And for good reason. We have a problem in society these days with a lot of people being overweight or obese. But for you, you take a different approach to this and pivot a little bit and say instead of focusing on the weight loss, we should be focusing on putting on muscle. So why is that?
Well, when I think about where we are in society right now, I think about this obesity conversation that is just so pervasive. And everybody talks about the obesity epidemic and that we should be losing weight. And the reality is we're not over fat. Right. An epidemic is something that kills people slowly or kills people swiftly. And we're not seeing that. Obesity, I think, is symptomology of a much bigger problem, which is low muscle mass, impaired muscle. I think that we have a muscle crisis, not an obesity crisis. And if you take the perspective of muscle and muscle as this organ of longevity and really this as the pinnacle of health and wellness, then you actually are much more empowered. We've been trying to fix the obesity epidemic for decades, and we are fatter, more unhealthy than ever before. And, and I always think if we have the correct problem, then we should be able to get a solution. So perhaps the correct problem isn't the fat problem, something else.
So what I'm hearing you say, for people tuning in saying, wait, I do have a weight problem, I'm tuning in to figure this out and get healthy. Yeah. You're just saying it's a bit of a nuance to that. We're going to get to the root rather than look at, the extra weight, which is a symptom. Totally. And to get to that root, we're going to talk about building muscle.
Yeah. And, above and beyond even building muscle is really understanding that muscle is an endocrine system. It's an organ system in and of itself. And muscle is so much more than just this fitness aspect that we think about it. Muscle is really critical for interfacing with the immune system. It's critical for nutrient partitioning, meaning the food that we eat. It's a critical component to insulin resistance. It's so essential when we think about the issues that ride alongside of obesity. So we think about obesity, diabetes, metabolic syndrome, cardiovascular disease, Alzheimer's, cancer, right? When we think about the metabolic input, and I simply mean by metabolic input, I simply mean the elevations in insulin, glucose, triglycerides, and this low level of inflammation that exists, fat and the diseases that ride along with it are really symptoms of the challenge with muscle. And so that's how I think about it.
And when it comes to the fat loss piece specifically, is a big reason that putting on muscle is a piece of that puzzle is because it enhances the metabolic rate?
The reason that it's so critical to put on muscle and to maintain healthy muscle, there's a couple reasons why this is so critical. Well, number one, when you think about skeletal muscle and what it does, skeletal muscle is the primary site for glucose disposal. The domains of muscle exist, number one, in locomotion, which is really important as it relates to not falling or being able to be strong, being able to maintain your activities of daily living, going to the grocery, putting your suitcase in an overhead bin, those kinds of things, the physicalness of even just being able to walk. So there's a physical aspect of muscle. Then there is a metabolic aspect of muscle. And the metabolic aspect of muscle, the way that I think about it is, number one, it's the primary site for glucose disposal. Glucose disposal, carbohydrate metabolism, fatty acid oxidation, that all takes place in a large part in skeletal muscle. As we think about skeletal muscle, which is simply the muscle that we have under voluntary control, right? So we have cardiac muscle, we have smooth muscle, which are typically the organs, and then we have skeletal muscle, which is under voluntary control. This muscle makes up roughly 40% of our body. Skeletal muscle is that primary site for glucose disposal, which is really the carbohydrate metabolism. And again, what I had also mentioned is a primary site for fatty acid oxidation. Skeletal muscle is one of the first stops and also the largest. And it's curious to me that when we talk about obesity and fat and all this other stuff, it's just like the fat appears out of nowhere. Well, it doesn't really. You have impaired muscle tissue first, or at least as one of the first key challenges within the human body.
Well, you've done a great job of convincing us that this is important. We need to put on muscle. When it comes to doing that in a healthy way, how much is enough? Because somebody might be tuning in saying, I don't want to get all big and muscular and look like a bodybuilder type figure, but how much is enough to gain these health benefits that we're talking about?
I think that this is a great question, and a question that everybody asks me: how much is too much? Now, I think that we have to take a step back and we have to think about how we look at skeletal muscle. How do we measure it? Skeletal muscle traditionally has not been measured in medical practices. It's typically just looked at as body fat percentage, right? Or BMI. And that is a huge mistake as it relates to being able to identify the importance of skeletal muscle. When we think about the tools in which that's really been utilized for skeletal muscle, the next thing that we think about is a DEXA. And that is a kind of X-ray. It's a way in which you can look at bone density, also lean mass, which encompasses blood and all the organs other than fat mass. And is that helpful? It is helpful because we can actually extrapolate a lot. But again, it's not looking at skeletal muscle directly. And I want to say this again. So a DEXA doesn't typically look at skeletal muscle directly. It identifies fat and identifies bone, and skeletal muscle is lumped in with all the lean mass. Okay, so number one, there are challenges which relate to the measurement of skeletal muscle as it exists. So again, in medicine, it's very difficult to change and appreciate what we're not measuring well routinely. So that's something to consider. And I'll just mention, for completeness sake, the other ways that are perhaps much more accurate in looking at skeletal muscle. That would be a CT and a DEXA, or a CT and an MRI, which obviously people are not really doing. Okay, so the original question is, how much is enough? And I would say, well, that really is a multifaceted question. Number one, we probably, unless we are a professional bodybuilder, all need more muscle. Okay, but more muscle alone isn't sufficient. It has to be healthy muscle. How do we get healthy muscle? We train it. We train it for strength. We train it for hypertrophy, which people say, well, that doesn't necessarily make you healthier. But actually, the goal is strength hypertrophy for a final indication or a final outcome of creating flux within muscle. Okay, so the listener's like, well, what the heck is flux? And we've all seen a marbled steak. Every single one of us has seen a picture of a marbled steak. And oftentimes, this is a good visual representation of what a sedentary, unhealthy muscle could potentially look like. And this is really the substrates in that tissue just remain static. There's no exercise to actually create utilization of these substrates. And I say this cautiously, but this is, that's not how it always looks. And athletes have different fat composition. But a good way for the listener to visualize unhealthy muscle is to really think about fat infiltrated into the tissue. And that fat infiltration is really an indication of a decrease in flux, a decrease in glycogen, an increase in fatty acid metabolites. And this really weakens muscle over time. It weakens its capacity to burn fuel efficiently. And ultimately, it potentially can lead to sarcopenia, which is issues with mass and function. And again, it's like a disease state of muscle.
This is really important. I'm glad you brought the quality piece into it. Yeah. And I've heard you talk about before, obese people actually have quite a bit of muscle because there's always that stress of carrying that extra weight. And this comes back to the quality factor, where they might have more muscle than a lean person who might work out a little bit, but that quality is subpar.
Exactly. And then by the time you are overweight or obese, you have impairments in skeletal muscle. And I think that, and maybe not everybody, but I would say the chances are if you have excess body fat, you have challenges within your skeletal muscle already, and then I think, okay, there's the strong man. But again, is that a marker of strength? You can be strong, but it doesn't necessarily mean that you're healthy. So, I'll tread lightly there, but if you are overweight or obese, then skeletal muscle is oftentimes there's a blunted response. So your ability to put on skeletal muscle or have the same kind of robust response as a lean person, it's different, right? And that's really just this process of muscle protein synthesis. It's potentially that there's a blunted response, and that tissue, that obese tissue, looks and works a lot like a older individual's tissue, like an aged tissue. And this was by, I think, Nick Bird did this out of, actually, he's at University of Illinois right now. This really was some the research really originated from him. He started looking at obese tissue and seeing that there was this blunted metabolic response with muscle protein synthesis. Now, that's not to say that if you are younger and obese that you can't course correct. Absolutely. I'll say that the older an individual gets, the more difficult it becomes because there's a lot of things that play into that, like a decrease in hormones and an ability to push to the same amount of exertion that one typically does.
Coming back to our original question there, how much is enough? You mentioned the different scans. Is there a certain scan you recommend for people to get a baseline?
Yeah.
I don't feel like we have a clear answer there. What is it
No, I do have one for you. I do have one.
No, let's get to what that looks like. Somebody who isn't obese, they're maybe working out a little bit.
Yeah.
And they're just looking to make sure they're getting that dose to get the different health benefits from that muscle.
Yeah. Now, I don't like looking at muscle alone because you do have to look at strength measures, and you do also have to look at metabolic markers like triglycerides, insulin, and glucose. One way that a person can kind of extrapolate this data is getting a DEXA, body composition DEXA, and putting it into formulas for appendicular skeletal mass index, which is simply max divided by meters squared. And there's certain ranges like and people can put that in. And these numbers are kind of arbitrary and aren't going to be helpful for the listener right now, but there's a certain cutoff that would indicate sarcopenia, and then there's a certain cutoff for athletes. And actually, I have some unpublished data that I'll be putting in my book, actually, that comes out in September, that actually puts together what I would consider a non-athlete ideal range. But again, it's extrapolated. It's not looking at a muscle under MRI or CT, but that's not feasible for people. So again, it's looking at a body composition DEXA and then putting it into a formulation, which anyone can do, in an appendicular skeletal mass index.
For the average person who's somewhat aware and wants to stay healthy and keep, a lean body,
yeah,
likely the best that they're going to have done to measure things is look at a BMI. And most conventional doctors, that may be as far as they go as well. So I want to talk about BMI and how that isn't necessarily a good marker. And we need to probably go a bit deeper to really see what's going on in the body.
Yeah, and I would say so. Body mass indexes was traditionally used, I think it was for insurance purposes. And basically, it's an outdated measurement. They still consider it valuable, but really body mass index. And it's like if you are a certain body mass index and it doesn't actually look at the difference between fat and skeletal muscle, it's like this weight measurement. I would say that I think that we're evolving past that. I mean, they're still utilizing it. I think what is much more relevant is body fat percentage. And that can be done a number of ways. There are now scales like impedance scales and looking at a body fat percentage. And typically the current recommendation is like, anything 25% or more is considered overweight or obese. And that's for a man. And then for a woman, it would be 30%. And, I think that these numbers are a bit too high. You do need a certain amount of body fat. But a good way to think about it, perhaps maybe, and again, this is just my personal opinion, is what were you in high school? What was your body fat percentage in high school? And typically, this is the time that you were the most anabolic and you're typically leaner, right? And I think that we've all seen it, that you had a certain kind of growth trajectory, and understanding where you were at that place. But that being said, body fat, you know, you could easily say, as long as a woman is still menstruating, maybe that's 15%. Maybe that would be her ideal to shoot for. Maybe it's 18%. And for men typically are lower.
Early in our conversation, you mentioned the fact that muscle is this endocrine organ,
Yeah.
which before preparing for this interview and diving into your work, I hadn't heard somebody talk about it that way. So I want to talk about this aspect of muscle and the myokines and how that all works.
So cool. Yeah. This was actually pioneered by a woman named Dr. I think her first name is, it's like Bente Pedersen. And she is in Copenhagen, and she is a physician. She studies exercise immunology. And her work was really, and still is very pivotal, and we don't hear about it so much in the US, but basically it looked at skeletal muscle as this endocrine organ, and there was this exercise factor. When you contract skeletal muscle, and the majority of the research is done in cardiovascular activity, that skeletal muscle secretes these myokines. Myokines are proteins much like cytokines, right? So the inflammatory cytokines that, say, are released from macrophages. And what's so interesting is they have a pleiotropic effect, meaning when they're released from skeletal muscle, they act differently in the body. They actually counterbalance inflammation in the body. So it increases this interleukin 6, which we always talk about as being inflammatory, like the cytokine storm, but actually exercising muscle can increase over 100-fold more of these myokines, which there's hundreds of different myokines, but let's say interleukin 6 or interleukin 10. And it's this exercise factor that affects the immune system. So, essentially lowering systemic inflammation, balancing other inflammatory cytokines like TNF alpha, also relates to nutrient partitioning. And why is this important, and what is nutrient partitioning? Nutrient partitioning is the way in which we utilize our macronutrients, the way in which we utilize carbohydrates, proteins, and fats. And oftentimes when we think about exercise, we just think about calorie utilization. But there's another interesting component to exercise, that there's an interplay between this interleukin 6 and these myokines that are released from muscle that, say, make liver more sensitive or make adipose tissue more sensitive. So essentially what I'm saying is there's an exercise factor above and beyond calories in, calories out. Like it's a very complex interplay, a crosstalk between liver, adipose tissue, and skeletal muscle that really originates from this exercising muscle. And that is, the definition of an endocrine organ. It has both local and systemic effects. And it's just very fascinating. So this is one way in which skeletal muscle is an endocrine organ.
So when it comes to this endocrine piece, how long does that effect last after somebody does a workout? And is it something we want to be triggered all the time? Do we want to hit that on a regular basis, or do we want periods of time where we don't have that effect in the body?
This is a very astute question, and obviously because you've been interviewing for a very long time. There are immediate effects that happen with exercise. The immediate effects are some of the things that I'd mentioned, that increase in interleukin, so the increase in those myokines, and then also changes in, say, HDL and triglycerides. They're acute effects. Is that where the magic is? I would argue and say it's not, quite frankly. The magic isn't in the acute effect. It's in the multiple chronic stimulation of these things. So what do we know when we chronically stimulate this exercise piece? Well, we see actually lower levels of these inflammatory cytokines just across the board. And you would think that they would be higher. They're actually lower. We also see white blood cells in a more desirable range, which is also interesting. There was a study, The study was okay. It was called the Drew study, but it looked at some of this, and it was interesting. And so there's a potential that the white blood cells are also a bit on the lower end. And when I say lower, I would say in a more ideal range. So that becomes very interesting. But again, your question is very astute. What is the dose needed? And I think that that is evolving. I think that the way in which we can look at that is that we look at the dose in terms of what is ideal for the human and what are the markers that we can measure. And we can measure strength, and we can measure body composition, and we can measure surrogate markers of muscle health like insulin resistance and glucose, or insulin, glucose, triglycerides, HDLs, HSCRP. But again, I think exercise physiology is a little bit of the Wild West as it relates to what would that specific input be. I say that, nevertheless, I think that there are particular recommendations that would be beneficial for nearly everybody. And that is, number one, focus on strength first. And that could be 3 to 4 days of training, but really there should be, and there's multiple ways to get an adaptation, right? And you can talk to some of my colleagues who are specialists in exercise physiology, and they would tell you a million different ways of a well-designed program. But, from a medical perspective, focusing on strength, thinking about how do we leverage strength, because that's very valuable. Strength doesn't mean you're necessarily going to grow bigger muscles. It can, your muscles will grow. But once you've established a baseline strength, I do think also layering on hypertrophy. And, some of my colleagues would also disagree with me when I talk about hypertrophy and what its relevance is. But hypertrophy is simply the way in which you make the muscle bigger. Initially, when we started this interview, you said, okay, well, what's the role of skeletal muscle and why do we care about it, if everyone's focused on obesity? And I said, well, skeletal muscle is the primary site for glucose disposal. How do we increase our capacity to have glucose disposal?
Put on more muscle?
You increase it through muscle. You have more muscle. You still have to train it to keep it, but the reality is you have more muscle, right? And again, Don Layman, my mentor of 20 years, we go back and forth because he said, well, it's not just the amount of muscle, that the data doesn't support that. But I would say, I think one of the reasons that we haven't done a good job about understanding the relationship of skeletal muscle and overall health is because we haven't had a great way of testing it and measuring it in a way that is clinically relevant and reproducible. We're starting to. There's going to be a way in which, I think this is out of Evan Williams' lab, or maybe it's William Evans. It's William Evans, Dr. Evans, talking about creatine. Like you can take a pill in which it labels creatine, and then you can measure creatinine as a way of measuring skeletal muscle, and that may track with an MRI. But anyway, this is a long-winded way of saying, skeletal muscle, what are is this acute or chronic? And I would say the changes are acute. We need chronic activity, and there's multiple ways of doing that.
Okay, you've touched on a lot of different points there. The acute, the chronic, the strength, the hypertrophy. What I'm curious about now is types of exercise, because we've been to this point, we've talked about resistance training, but we've basically been saying exercise. So how do you feel about using different forms such as HIIT training, going for long walks, resistance training with weights versus bands, to give people an idea of what these different inputs are going to do when it comes to muscle?
Yeah, I believe, and on my podcast, I just interviewed a phenomenal PhD. His name is Pat Davidson. And we talked a lot about this. And he said, it's what is the input that you are trying to get for the outcome, right? So if it's strength, there's multiple ways to engage strength, but really getting to a heavy lifting load, again, is it a machine like a hack squat? How do you choose an exercise? But I think heavy weight training for strength is probably irreplaceable. Could you do bands? Probably initially, right? But again, can you lift heavy enough to kind of move the needle? Likely. Sorry, this is real life. This is a Friday after Thanksgiving, American Thanksgiving, and so the kids are home. Everyone's screaming, but it's good.
All good.
This is good, right? This is real life. We're in it. So
Totally.
again, listen, could there be multiple ways in which you move the needle on strength? Yes, there can be. I think that a good way to think about it, however, would be how are we lifting weights? Because that can be utilized, and you're going to have to go heavy enough. Could you do that with bands? Probably up into a point. So that's one aspect. And then hypertrophy, really, again, it is about muscle fatigue, progressive overload over a period of time. So this could be, listen, free weights, bands, machines. And I'll also mention, you said strength. I think kettlebells are also pretty awesome. Kettlebells can be used for a combination of high intensity kind of activity and also dynamic movement.
All right, I want to take a pivot here and move into fueling the muscle. So let's get into the dietary piece. And we could break this up into a couple different parts. One being how we fuel to exercise and put on muscle, and then fueling the body in general to sustain.
Yeah, I think a good rule of thumb is, putting on muscle typically will require a certain amount of protein, right? It'd be very difficult to put, if not, maybe nothing is impossible, but be very difficult to put on muscle in a calorie deficit as a rule. Could some people do it? Yeah, but I would say a more effective way for putting on muscle would be really optimizing for dietary protein and understanding where your baseline calories are, and then incrementally going up by 10%. How do you determine baseline calories? There's multiple ways in which you can go online. My very dear friend, Alan Argon, has a great calculator. You can determine calories. And then obviously increasing dietary protein is so valuable, again, above. So I typically recommend a gram per pound ideal body weight. If you are looking to put on muscle, you can go higher than that. And then if you were looking for muscle glycogen repletion from training, carbohydrate intake, you can easily do a 1-to-1 ratio of protein to carbohydrates. And then fat, people will argue, is it carbohydrates or fat that's more important? And I would say, listen, focus on protein, then focus on carbohydrates, and then focus on fat.
All right, that gives us a great overview. I really want to take some time and get into the nuances, starting with protein. This is an area you can talk extensively on, and an area I haven't really delved into a lot over the years on the show. So let's get into that. And I think a good point to start off is the fact that when people are looking at nutrition labels, all they're seeing is protein and how many grams.
Doesn't that blow your mind?
And that is just such a big umbrella term because there's 20 amino acids. There's 9 essential amino acids, which we can only get through the diet.
Yeah.
So let's break this down and talk
Isn't that
about
crazy, though? Like,
it is.
No one brought that up before. How is it that you look at a label and we talk about protein as this one nebulous thing, but really it's 20 different amino acids, yet that's not really represented in the labels. It's really interesting.
Well, let's get into the nuances. Somebody that wants to take good care and make sure they're getting all the amino acids in the right ratio, because labels aren't really going to tell them that. Actually, they're not going to tell them that. How do they go about looking at that?
It's tricky, right? So I don't know what the labeling law is in Canada, but typically there's a % daily value. So you'll be able to kind of calculate, and listen, no one's going to do this. I don't even do this. You can kind of calculate if it's, how many grams of protein, and then the % daily value will be significantly low if it is a low quality protein. But I think a good rule of thumb is to understand that if it's a high quality protein, meaning if it's an animal based, is it beef, chicken, fish, eggs, dairy, whey, that the label that what you're looking at is typically relevant, right? So if it says 20 grams of protein, it's 20 grams of protein, but if you were to look at something like hemp protein and it says 20 grams of protein, you'd probably want to cut that in half. So even though it says 20 grams of protein, because of the amino acid discrepancies, you're probably looking at the body recognizing about 10 grams of protein. So if it's a plant-based protein, it's, you could cut it in half, or maybe, think about it in terms of it's like 75% maybe.
And how do you feel about protein powder supplementing a diet,
That's great.
a healthy, well-balanced diet?
Yeah, now I always believe that a whole foods diet is best. That being said, I'm very busy. For the listener, I have two screaming children in the background, which I profusely apologize. It's nap time. But don't worry, we have help there. And working on getting the babies down for a nap. I'm really busy, so I might drink a whey protein shake. Easy, right? So I know that I drink it all at once. I'm knocking out my protein intake. I think that I do have some concerns about the rice pea blends. And why do I have that? Whey exists in nature. So let's say whey protein is processed, or like a whey isolate might be processed. I can appreciate that. But a whey concentrate, you get that in nature, right? Whey does exist in nature. I have no data to support this, but I can tell you from a provider standpoint, and just from someone who, I trained in nutrition, professional training for 7 years in nutrition, plus clinical experience and blah, 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 and a fellowship, is that when you take something natural and then you adulterate it in a way where you isolate it, for example, pea, and you make something that doesn't exist from like you make a pea into a protein and you give this isolated compound that doesn't exist in nature, I have concerns. I have concerns no matter how you do that, right? No matter what food it is. If we did that to a red meat component or whatever it is, I think that when you make something that doesn't exist in nature, when you take a whole food and you create it in a way to augment food, I think that pea has estrogen-like activity. I think that there's compounds that perhaps we shouldn't be getting in those high doses over a lifetime would be concerning for me.
And I've heard people talk about the number of peas you would need to condense down to make a bag of that protein.
A lot.
And I've
right?
also heard about the concerns of contaminants within those plant-based proteins when you're taking such a large volume and condensing it down.
Yeah, I mean, I have to say I agree with all those things, and those things are concerning. But again, if you think about it in cycles, and let's say someone is more vegan or vegetarian, then I can appreciate that that's a way to utilize plant-based protein without such an increase in caloric load. Can totally be done. Yeah. So, but I do have concerns, right? I have logical concerns that I think are valid.
One thing I've heard you talk about is the fact that the first meal of the day, we want to make sure we're getting a good bolus of protein. So
Yeah.
what does that look like, and why is that so important?
The traditional research in dietary protein really stems from that first meal of the day. So really all the data has all been at breakfast. It typically is not done at lunch or at dinner. And the reason is it's just easy from a scientific standpoint to be able to leverage that first meal of the day because it doesn't have all those compounding variables. You're coming off of an overnight fast. And so the data for muscle protein synthesis typically is really the primary point is that first meal of the day. It allows for, whether someone is doing a clamp or someone is doing like a muscle biopsy. And so the majority of the research has really identified that first meal is very valuable, right? And that's where the data has typically come from, out of Don Layman's lab and many others. So why is it so important? Well, number one, we have evidence to support the impact that it has on muscle protein synthesis. And muscle protein synthesis is a surrogate for, it's not a direct correlation. So you don't stimulate muscle protein synthesis one time and all of a sudden you have like a bicep that looks like Arnold Schwarzenegger. That's not what that is. But muscle protein synthesis is the best marker that we have for the laying down of new proteins over time, right? And muscle protein synthesis is very robust at that first meal, coming off of an overnight fast where essentially the skeletal muscle is catabolic in an unfed state. And that first meal, you will likely get the biggest influence from the amino acids. Because, we don't really know what happens. It's very difficult for us to look at dinner and lunch. But that first meal, we know. And so we know that coming off after an overnight fast, that the muscle is primed for nutrients. It's hungry, essentially, and primed for nutrients. And really hitting 30 to 50 grams to stimulate that muscle protein synthesis is ideal. And that number really comes from an amino acid threshold. And the amino acid particularly is leucine. And if you are plant-based, you'll need to go to the 50 grams or higher. If you are more animal-based high-quality proteins, 30 to 50 grams would be ideal.
I want to get into the nuance of this a little bit more. So we got muscle protein synthesis. So we're having this bolus of protein. Is this basically the laying down and the building up of our current muscle?
Muscle protein synthesis over time, that's the belief. So over time, muscle protein synthesis is the laying down and building up. But again, I caution the listener to think about it that way because it's very incremental. It's very incremental over a period of time.
And I'm curious, for somebody that does a workout, say the day before, versus somebody that isn't working out, or they've just taken a break and they're not working out, for a few days, how does that protein impact the muscle differently in those two different states?
So if someone is not working out versus working out, well, you can't.
Yeah, picture somebody that worked out the day before and then they hit that protein bolus the next morning versus somebody that's taken a break a few days from working out, or they're a sedentary person. How is that going to interact with the muscle differently?
Again, a great question. Definitely asked by a seasoned interviewer. The sedentary muscle, from my perspective overall, is unhealthy muscle. Sedentary muscle is typically muscle that's already kind of saturated full of glycogen, fatty acid substrates like diacylglycerol, those kinds of things. However, I will say that muscle still needs amino acids. It needs amino acids for recovery and repair, even if you're not totally utilizing it. Because skeletal muscle does go through a turnover process, right? There's tissue turnover in every part of the body. Again, a minimum of 250 grams a day we're probably turning over. So a non-exercising muscle that is fasted is still primed for muscle protein synthesis. But again, this is a very nuanced question. Is that sedentary muscle obese? If it is, it's probably going to take more protein to actually create a stimulus effect. But if the person is lean, a 30 to 50 gram amount would be perfectly adequate. Now, let's take this one step further. If an individual is an older muscle, so let's say it's an older individual who is sedentary, I still recommend this bolus amount of protein. And I'd probably push them to the higher end of, say, 50 grams of protein. And the reason is because it will trigger a response that would be essentially youthful, like a youthful response, meaning muscle is this nutrient sensing organ. Its capacity to sense nutrient decreases as an individual ages. There's some question whether that is true or if it's just inactivity. But either way, if you are sedentary and obese, 50 grams. If you are older and or obese or not obese, 50 grams. If you are younger and healthy and active, you can get away with 30 grams.
From your experience, how many people do you feel like are hitting even that 30 gram threshold?
Yeah. So the NHANES data, which is the largest data set, would suggest that, 50% of women over the age, I think it's like over the age of 50, are not meeting their dietary protein needs. Don't quote me on that, but it's something like that the average woman is getting 68 grams of protein a day, and the average male, according to this NHANES data set, is getting about 100 grams of protein.
And this can tie back to what we talked about before, the whey protein, the plant-based protein powders.
Yeah.
And then I want to get into now the branched chain amino acid supplement. Are you a fan of those?
I'm a fan if you're vegan or vegetarian.
Okay,
if you're vegan or
talk more about that.
vegetarian, that would be the way to utilize a branch. So the branched chain amino acids are leucine, isoleucine, and valine. They are essential amino acids that you have to get from the diet, although arguably maybe the gut microbiome, if you are a unicorn, may make that. But for the majority of people, the branched chain amino acids must come from the diet. And typically a vegan or vegetarian diet is lower protein quality, just simply meaning that it's lower in these essential amino acids. The way to kind of compensate for that, again, this compensates for the amino acid component. It doesn't necessarily compensate for the iron or the creatine or the taurine or the anserine or some of these other components, but certainly the way in which you can account for it for a protein, from a protein aspect, is by adding in a scoop of branched chain amino acids to that lower quality meal.
So can we look at that supplement as basically the other protein powders, the whey and the plant-based, are taken from food one step down, would the
Yeah.
branched chain amino acids be an isolate almost from like a protein powder?
So it depends on where the branch chain comes from. I think some, like, companies, they are, comes from like silkworm or wherever. There's, I don't, not really up to date on where they're coming from.
How do
But
you
it's a
feel
great
about
question.
the
Yeah.
association between amino acids and cancer? There's research out there talking about that.
Yeah.
And then I want you to address it from two different points. Amino acids from the diet versus supplementing, where we're going to get in a more concentrated form.
It's a really interesting question. And I think that this has been going on for a long time. And I would say before this paper that came out in 2016 in Cell, it was pretty much like put to bed, the connection between amino acids and cancer. So first of all, let's talk about cancer. So cancer is a disease of the genome. And there's initiation factors and there's promoting factors. An initiation factor of what causes cancer is a defect in the genome. That's not caused by something that you eat, right? Like you're not going to directly impact an initiation factor from an amino acid to cause cancer. So there's that. Then the next question is, what kind of cancer are we talking about? Are we talking about breast, uterine, ovarian, lung, I don't know, prostate? And I think that needs to be discussed, right? So what kind of cancer are we talking about? And aside from a genetic component, what is the biggest risk factor for cancer? Do you know one of the biggest risk factors for cancers?
Oh, so many. Obesity. Environment.
You stop there. Obesity, the one thing that we could have control over, right?
Yeah.
So if we talk about
environment too, but
I mean, I don't know. I
to a point.
Control. Yeah. I mean, I live right outside New York City. When I lived in New York City, there's no way I could, as much as I put like air filters in, there's only so much I can do, right? But the concept that, number one, cancer is a disease of the genome. And number two, what kind of cancers are we talking about? And number three, like, where is the connection? So again, and what is the risk? So one of the major risk factors of cancer, depending on what kind, is obesity. Do you know one of the other major risks of dying from cancer is?
Old age?
Cancer cachexia. So
which could be associated with old age.
So cancer cachexia is muscle wasting.
Right. I guess that's why I'm associating with old age. A lot of people as they age have less muscle on the body, but that's more directly from the cancer. Go ahead.
Exactly. So the skeletal muscle is actually what can improve survivability from cancer. Cancer cachexia, regardless of the kind of cancer, has a high probability of killing someone. So basically, how do you support muscle?
Resistance train.
And?
Eat the right foods.
Which are?
Protein.
So basically, you're telling me one of the biggest risk factors, if I'm hearing you correctly, is obesity, right? Aside from genetic. And then to help survivability, you have to protect muscle. So those are the obvious logical things. And then somehow, miraculously, there's this conversation of dietary protein and cancer. So to me, from a geriatrician perspective, so that means I take care of, fellowship trained from WashU in individuals over the age of 65. To me, it doesn't make sense, right? So sarcopenia, muscle mass, and all this other stuff. And so if we were to now go back to your original question, what's the connection between cancer and protein? And this really comes down to this one mechanistic pathway, which is mechanistic target of rapamycin. It's called mTOR, and there's mTOR1 and mTOR2, and mTOR1 is in every tissue in the body. Your brain, your pancreas, your liver, your muscle. Mechanistic target of rapamycin is exquisitely sensitive to nutrients. It's a growth promoter. It's sensitive to insulin. It's sensitive to excess calories. It's sensitive to exercise. And the sensitivity is different in every tissue, right? You with me so far? This is critical. mTOR, when chronically overstimulated, is considered a growth promoter and can be a problem if someone has cancer. if somebody already has cancer. So if someone has cancer, then growth promotion is a problem. Okay. So what do we do? So if you believe that to be true, then let's talk about the impact of mTOR on the tissues. So one of the worst things for mechanistic target of rapamycin in the space of cancer is to be chronically stimulated and overstimulated. The major way to do that is through excess calories, excess insulin, and excess carbohydrates. Liver, pancreas. When it comes to protein, mTOR is exquisitely sensitive to amino acids in skeletal muscle only. So protein stimulates mTOR primarily only in skeletal muscle. So the connection is, like if they were going to be able to prove that, then we should see some randomized controlled trials that dietary protein and its relationship to cancer, and that's never been proven. And in fact, when the information has been analyzed and we look at relative risk or risk ratio, it's never been shown to be clinically relevant, like ever.
One little thing within that I want to tease out is, isn't it true though, if somebody was to take in an abundance of protein through gluconeogenesis, that could be converted to glucose in the system and then impact the system differently?
Great question. I would say that excess protein definitely can get converted to, and just protein in general. So protein in general gets converted to glucose, but it's much less efficient than eating straight carbohydrates. And also the impact on insulin is it's a phase 1 insulin response. So if you gave 50 grams of dietary protein and 50 grams of glucose, the insulin responses would be vastly different. But yeah, absolutely. And I think that when you have, so for every 100 grams of dietary protein, you'll convert to 60 grams of glucose through gluconeogenesis, which is a much slower process, and a way to maintain blood sugar levels without constantly eating carbohydrates.
Another little piece I want to make sure we tease out while we're in the weeds on this is the supplements of amino acids versus having that through whole foods, because obviously it's going to hit the system a lot harder if we're having that in a supplement form condensed.
Yeah.
How do you feel about that in the whole conversation around cancer?
Again, I think the question is do I feel that protein has a role in cancer? I don't. I feel that cancer is a disease of the genome. I think a risk factor is being overweight. I think a risk factor is excess calories. It's not a protein issue, right?
No, that's why it's good that you're teasing this out. You're the expert in this area, so it's good that we're getting into this because, branched chain amino acids are getting a bad rap, at least in certain circles. So it's important we hash this out.
It's unfortunate. And, you have to understand is branched chain amino acids are going to be elevated in the blood with someone who's obese, but also insulin, glucose, every substance, is going to be, these substances are all going to be elevated because it's, that there's a dysregulation in the metabolism. Gluconeogenesis is not shutting down. It's if you become insulin resistant, you have excess glucose, This is not a protein problem. The only reason it becomes a protein problem is because people believe that you shouldn't be eating dietary protein. And I think the question is why? And unfortunately, I think that one would have to look at what is the agenda behind that. And I think that it can be very devastating for people's health. I think the worst piece of advice you could ever give someone who's aging is to reduce their dietary protein. It's hands down the worst piece of advice in the prime protecting years of skeletal muscle that you could ever give someone is to fast and eat low protein.
Let's talk about dosage. We talked about the bolus of protein, the importance in the morning. If somebody is going to either through supplements or through diet take in that protein, how long does it sit around in the system? And then how does this tie into when we're going to train?
I think that it doesn't really matter. Protein prior to training, you don't need because, again, you stimulate the tissue through resistance exercise. So, the evidence that ISSN, so the International Society for Sports Nutrition, their recommendation is it's more relevant the 24-hour period of dietary protein. So from my perspective, you don't need protein prior to training. People would argue it doesn't matter when you eat protein afterwards, but I would say if you are older, if you have any kind of inflammatory process, if you are overweight or obese, I think that you benefit from protein post-training. Whether it's 30, 90 minutes, I think that your muscle is primed for nutrients. I think that you can also, you've stimulated the tissue. So the tissue, at least from the aging research, is more likely to respond like a more youthful tissue. I think that there's value in that. And I also think that, let's say worst case scenario, we don't have value in that. There's no harm in creating a habit that allows for executing and getting your protein dose. I think that there's no downside.
Okay, so we have this common thread of getting the protein bolus in the morning. My question now is, does it matter when in the morning? Because there's so much talk these days about the health benefits of intermittent fasting, pushing breakfast, and then there's a lot of talk I'm finding more lately of eating breakfast and skipping dinner. So let's open up the conversation on intermittent fasting. Are you a fan ever? Is it something you practice, and how does it fit into this whole protein equation?
Thanks for this question. I was a fan until I was a fan of fasting all day and having my meals later at night until I really looked at some of the research with Christine Holmes. She's amazing. She's a female PhD, and we work with very similar groups in terms of special operations and individuals in high stress situations. And she was saying, listen, Gabrielle, everyone is talking about fasting during the day and then eating, say, at like 1, 2 o'clock, and then eating into the night, which was what I would do. I would fast till noon and then eat till 8 and then stop. And she said, the circadian biology data doesn't support that. And she also said that the circadian biology data would support eating earlier on and stopping when the sun goes down. So front loading your intermittent fasting window earlier. I have yet to do that, but that would be the next thing on my list. It's harder because then you have to actually be able to control your hunger by yourself, as opposed to, you're still in that, whatever hunger control phase. And then, once you start eating, you're hungry. So I have been rethinking my fasting strategies, but I've not yet implemented.
And we could tie this new fasting strategy that you're yet to try to sleep, because it's often recommended to take a few hours, at least 3 or 4 hours before going to bed, to let the food digest and get a better sleep that way. Where I want to go with this, let's tie sleep to muscle building. So we've talked about the resistance training. We've gotten into the nutrition. This is another pillar here that we need to consider. How do you feel about that?
Yeah, I think that, obviously during the times of recovery is key. You're not growing when you're training, you're growing when you're recovering. So sleep is essential, and it's essential for a multitude of reasons, especially from a physician standpoint. It's essential for brain function. It's essential for nervous system regulation. It's essential for stress management, right? All these things are super critical. But again, also growth and metabolic regulation, right? We know that night shift workers really struggle with glucose regulation and insulin, regardless if they're isocaloric, meaning if they have the same amount of calories, and they're just flipping their sleep-wake cycle. I mean, there's problems. So sleep is essential. It's also the time that the brain cleans itself.
So it's something you prioritize.
I'm a mom of 2. I do the best I can. 2 very little children, but when I can, I do. For sure. Again, we all have cycles, right? There's always, are you in a push cycle? What is the season of your life? But if people can prioritize sleep, I think it's even more valuable than we recognize.
Well, while you're on the topic of cycles, let's talk about different phases of life and the importance of resistance training during those different phases. So let's start young. You're somebody with young kids. At what age would you recommend somebody start to maybe work out in front of their kids, spark that interest? And when would it be too young for them to work out?
I mean, I've always worked out with my kids either strapped on me or with them. And my daughter is a little over 3 and my son is 20 months. So I worked out with them in my womb, and I worked out with them when they were born, and I strapped them to my chest, and we do family yoga every night. We always do a push-up challenge. We do physical activity all the time. It's very critical because the female really sets the stage for the unborn child. The more physically fit she is, there is potential that translates over to the health of the child, and that you're born with a certain, like birth weight determines grip strength, which grip strength is a marker for, certain marker for health and all kinds of things like mortality, all that stuff. And I will say that there's a natural strength. I was just talking to Dr. Samuel Buckner, and he is out of the University of South Florida, and he runs a muscle physiology lab, and he looks at the input of resistance and strength on all things muscle hypertrophy. And we had a really interesting conversation, and the conversation was really that you develop natural strength in adolescence. So as strong as you are going to become from an untrained perspective, like, for example, if you and I were to get on a bench press, one of us, like if we're exactly the same size, one of us is going to have more natural strength. And that really natural strength is kind of what you build when you are in adolescent and young adulthood. And it's a way in which you are developing your tissue. And once that window closes, you don't actually develop more natural strength.
Wow. And at what age does that window close?
Probably when puberty's over.
So that's a window as a parent, you'd want to encourage your kids to be physically active, resistance train, and build that foundation.
Yeah. I mean, we do it all the time. Poor kids. They have a great time, like it's great. Super valuable.
Well, let's talk about later in life. We've touched on this a couple times through the conversation. As people get older, it is very important that people remain active and maintain that muscle strength.
Yeah.
So let's talk about for somebody that is tuning in right now and they haven't been aware of this, they haven't been building that baseline in adolescence or even midlife.
Yeah.
What can they do later on in the game to be most protective as they continue to age?
Yeah. It's never too old to get strong. I feel like it's never too young to be strong, and you're never too old to be strong. And that would be, I think that there's multiple ways to push an adaptation. And that could be through blood flow restriction. Obviously, check with your physician. It could be through the stim suits if you don't know how to contract skeletal muscle. It could be machines. It could be kettlebells. There's a whole, it could be bands to start with. But you do have to incorporate resistance, so strength, not necessarily hypertrophy at the older ages, really focus on strength. I focus less on hypertrophy because hypertrophy is something that you have to always maintain, but strength is critical. So you focus on strength, and if you're older, it is also about pushing yourself. You don't get to be off the hook, right? You don't get to be mentally off the hook and not push yourself, which I think I see all the time is, oh, well, I'm older, I don't want to get hurt. There are ways that you can train without a significant cost of doing business. And I think that becomes critical to understand. It's never too late, but working with a fitness professional is important.
And for somebody that is older and they're just getting started, they don't want to over push it in the beginning while they're building up, or they have certain time constraints and they can only do, a certain amount of workouts or work out for a certain period of time. Are there certain muscle groups that are more important as we age that we want to focus in on?
Let me interject something here. People say they don't have time. And the reality is, if you don't have time for fitness, then how do you think you're going to have time for sickness? How are you going to have time for that? You don't have time for fitness, then you're going to make time for some kind of illness. And that's the reality. So essentially, someone doesn't not have time to do that. If you think you're busy now, can you imagine what it really looks like? So I do think that that's really important to clarify that it's a non-negotiable and you have to make time. That's the reality of it. So there's that. And I forgot the second part that you
Well,
said.
just certain muscle groups they
Oh,
would
muscle
want to
group.
work out
Yes,
to get
yes, yes,
more,
yes.
or even
Leg strength
functionally
is
as
key.
they're getting
Yeah.
older, they want to have certain
Leg strength.
movements available to them as they age. So where
So
would they want
leg
to
strength is
focus their energy?
leg strength is key. Um, leg strength is key. And you want to make sure that you can also respond to any kind of quote ballistic movement if you fall. So that means being able to step off a box or being able to catch yourself if you fall, being able to respond to some kind of physical insult. So leg strength, carries, again, as you're older, kettlebell carries are great. Squatting, assuming that you can do squats well, I would, consider a front squat with the kettlebell, can help improve a hack squat where you have a lot of contact, these kinds of things. So overall leg strength is really critical. That'd be the first thing. And then, being able to carry and lift things overhead. So as an individual ages, I'm much less likely to recommend single bodybuilding type movements and much more likely to introduce or have them work with their trainer to do more functional type movements.
We talked a lot about diet and protein and the
Yeah.
importance of protein. We even got into protein powders, but we
Yeah.
didn't get into supplements. I'd like to
Yeah.
talk about, in a general sense, supplements that you recommend and take. And then for people specifically when it comes to muscle building, what they might want to include on top of that.
Yeah, so if you are looking for muscle health, I typically recommend creatine. I recommend fish oil, omega-3 fish oil. I recommend vitamin D, and I'm really big into urolithin A these days. Urolithin A is it's almost like a prebiotic. It's made, 40% of people cannot make it, and it helps with mitochondria health. It helps with mitochondria turnover, density. It's really good for endurance, those types of things. And I like it because there's some good scientific evidence out of Europe that I think is very valuable so far, and the US. But those are the things that I'm really, really into right now.
Can people get that from food, that latter one?
Urolithin A, some people, which is why I recommend supplementing, not everybody. So for example, urolithin A is a compound that might be found in pomegranates. You may or may not be a metabolizer of it. So a way to get it and ensure so you don't actually create the urolithin A would be supplementation. Right now, I've been using MitoPure, amazing company, amazing people, amazing product. So this is it's very rare I get excited about something, but I've been very excited about that. So urolithin A, and again, vitamin D, fish oil, creatine. And if someone is interested in whey protein powder, I use First Forms. They have a natural whey. I tend not to use a bunch of different flavors, those kinds of things.
And how do you feel about collagen? How that relates to, we've talked again about whey protein, just mentioned it, but
yeah, so collagen has a protein score of 0, meaning it's an incomplete protein. I think collagen is great for hair, skin, nails, and even gut health, but it is an incomplete protein and it does not count towards protein, dietary protein. Doesn't mean that it's useless, but it is not helpful as a complete protein or for a protein essentially for muscle.
Let's talk more about creatine. You mentioned that one first. And when I think of that supplement, I think back to, being a teen and certain people that take that when they're trying to get that hypertrophy that we talked about earlier.
Yeah.
But I'm hearing about it more and more in the health and wellness space lately. So talk about the many different benefits of that and who might want to consider taking it. Is it everybody or just somebody that wants to put on more bulk?
Yeah, I think that creatine can be beneficial for individuals who eat a low red meat diet, and it's about 5 grams a day. Men and women, maybe men can go a little bit higher. The benefits, and I don't actually, I should look into this, but I don't know the mechanism of action of brain health for creatine, but for aging and brain health, creatine across the board is supposed to be very helpful as somewhat of a neuroprotective effect, which is interesting. And who should take it? I do believe someone who's older, definitely. And again, a vegan or vegetarian, I definitely recommend those individuals take it. I also recommend individuals that are on a lower protein diet also benefit from taking it. Yeah. And it's been around for a very long time. Again, the longer something's been around, the more, I think the more an individual should have trust in it, because by that time things that have been, it's been exposed. If it's been around for 60 years at this point, massive adverse effects are going to be known. And I think the major issue would be GI effects.
You mentioned how you're mulling over the idea of later closing that eating window later in the day and eating more focused in the first half of the day, I guess, all the way to an earlier dinner. But take us through what a typical day looks like now. When are you working out? When are you eating? And what are you eating?
So I'm super bored with my workouts right now. So typically I just finished my book. So the whole goal was to maintain muscle mass and try to get stronger. So I'd been doing 3 days a week of heavy leg training, Monday, Wednesdays, and Fridays, and then throwing in a longer cardio session and some kind of high intensity interval sprint in there. And I'm just bored to tears. So basically I have now added in a CrossFit 1 to 2 days a week, and changing up my resistance programs to more dynamic movements as opposed to the heavier squats and like leg type stuff. So adding in some more jumping and faster turnaround. But I'm looking for a competition. So if any of your listener knows of a good competition, maybe it's like kettlebell or CrossFit, something. I'm looking for something new.
All right. Talk about the diet piece. When are you eating? What are you eating?
Well, I haven't eaten yet today, and that's pretty late for me. But typically, that's not true. So I had a bowl of cottage cheese. I'll have a robust amount of protein. And then I think I used Nancy's. There's some prebiotics, some fermentation in there. I think that that's really valuable. So I had some cottage cheese, and I'll have a steak for dinner or a steak at that next meal. I'll probably have some fruit, steak, and maybe some kale. I'll have, typically, again, today was a really busy, not normal day, but I'll have 3 meals today. And that will be some kind of red meat, some kind of vegetable, fruit, maybe some yogurt later.
And as a female, how do you approach eating and working out differently than a male, if you do at all?
I don't. I think that one of the things that happens is, say perhaps I don't eat as much as my husband, but I don't. I think that when we introduce more barriers or more friction, like do we need to train with our cycles and do we need to do all these other things, I think that creates a barrier to entry and a barrier to consistency. So oftentimes it doesn't have an impact for me. And I would say unless someone is really an elite level athlete, unless of course they just really can't train, that less barriers to entry is better. Less complication is better.
Well, one barrier I'm sure happens both for male and females is they may resist getting into at least heavy resistance training because they don't want to put on bulk. So let's bury that myth and talk about, why they don't need to worry about that and they can get in the gym and really push it.
Yeah. I mean, I think that's just like, I just can't believe that that's still not something that hasn't, I can't believe people still believe that. It takes a lot to put on mass. It takes a lot of time and attention, and you're definitely going to put on, mass, if possible, probably half the speed of a male. So women, I've never seen a woman come to me and say she's getting too bulky.
What about men?
No, never. I've just never seen it happen. I mean, listen, I've only been practicing since 2006, so maybe somewhere along that line it's going to happen, but that's how many years in practice is that? It's a long time in practice.
So we've talked about the sleep piece. We've gone deep into nutrition and protein. Yeah. We've talked about exercise, resistance training, supplements. What other pillars have we not addressed that's important for somebody, health in general, or specifically to resistance training?
Yeah, I think the biggest pillar that hasn't been addressed is the mental piece. And the human condition, if that isn't addressed, nothing else matters. So the people listening to your podcast probably have listened to it for years and heard lots of really good advice. And the question will be, how much is being implemented? And whether it's the listener, whether it's myself, whether it's anybody else, the reality is the human condition doesn't like for unfamiliarity. So what does that mean? That means all of these concepts we're talking about are great. If you are not aware of your own human weakness and you are not aware of your own human condition, specifically is knowing where you fail and where you're unlikely to start. So for example, someone might listen to this and have 5 million reasons why they're not going to implement it. And it's really not because they're not going to implement it, it's because it's unfamiliar. And so the brain will try to create an excuse or a reason as to why you don't need to do that. And it's not personal, it's just the brain doing what it's doing, keeping safe. And people have to appreciate the role that that cognitive error plays in a willingness to get better and to get healthier. So number one is really understanding your human weakness and the narrative that you're telling yourself. And if you can outsmart that, then you'll be able to execute. And then I would say that the biggest hurdle that I see, the second biggest hurdle, is understanding that there's a self-worth health threshold. And this is people will only get as healthy as their own self-worth. What does that mean? That means that, again, I've been seeing patients since 2006, and those that feel worthy of health will continue on a plan. Those that don't feel worthy of health will subtly sabotage themselves. So they'll get so healthy, like they'll lose a certain amount of weight, and then they'll feel great. And that feeling great is a very uncomfortable feeling, and they will do whatever they can to then push themselves back into a domain of where they feel comfortable. And that's really critical also to understand, and then move that upper limit threshold forward. Because again, it's only a unconscious implication that can easily be adjusted as long as it's brought out into the open.
So for those two pieces, you've talked about the awareness, but is there any other advice you can give to break through for people who are, feeling the resistance mentally and they need that extra nudge?
Yeah.
What would you say to them?
Yeah. So I would say, appreciate that the brain is doing what it's doing, and that you can have the resistance, but it's either going to own you or you're going to own it. Right? You got to go through it, and you might as well just do it. Yeah. Be stronger than your own resistance. You have to be stronger than your own resistance, period. And everybody can do that. Everybody can do that.
And I always talk about how maybe listening to an interview like this is a moment of inspiration, that if you're feeling that, act on it. Get that inertia started. Because, day-to-day life, it's busy for all of us and we can get stuck in our patterns. But if this interview is acting like a pattern interrupt and creating that space for you to create a new habit, use that, form the momentum, and then hopefully you can sustain that as a habit over time. Yeah,
totally. And then understand that you might hear this and be inspired and realize that there are going to be periods of times where you're totally uninspired and you can't wait for inspiration. Doesn't matter. That's just not the way that it goes. You just have to execute. And ultimately, the more you execute, the easier it gets. And again, you should expect it and anticipate the fact that you're probably going to tell yourself 1,000,001 reasons why not. And again, as long as you know that that's coming, then you decide.
I know your husband's a SEAL, and it sounds like some of that mentality from a SEAL has trickled over in.
No, I was like this before. No. I was like this before. It's probably why we connected as much as we, have and do. And also, a lot of my patients are military operators or entrepreneurs. And, people always talk about setting goals and this is the goal. And I would say we don't set goals. We set standards for behaviors, standards for who you want to be. And I think that that's very critical. And again, goals come and go, but a standard of being and a standard of way in which you execute doesn't.
Gabrielle, I know part of your story, you've had this really interesting journey as part of I think it might have been part of your training as a doctor, or after, you can clarify that.
Yeah.
But you've gotten to work with a lot of elderly people on their deathbed. And where I want to take this, we're making a big pivot here at the end, but I think this ties back to the inspiration piece, where you've had this unique look, talking to these people and seeing what life is like at the end, where we can all, I'm sure all of us have taken time to think about that and process that. but I'm sure it's different when you're actually in that part of your
Oh,
life. So
terrible.
talk
Yeah.
about what
Yeah.
that was like for you on the other end, plus what you're able to take from those experiences and still apply into your own mentality in your own life that you can inspire us with.
Yeah, I think that it was probably the most difficult time. I wasn't prepared for that. I wasn't prepared for so I did my fellowship at WashU in St. Louis, and I did my fellowship because I was wanting to study obesity medicine and nutrition. And that's why I went there. And part of the deal was in order for me to go there, part of my funding would be that I would have clinical responsibilities to become a geriatric fellow. I didn't want that. That wasn't what my choice was, but it was presented to me that in order to do X, I had to do Y. Um, so I was very into this health and wellness. And then all of a sudden, I was dropped into a category of patients that I had never serviced before. I mean, you do when you work in the hospital, but you're not seeing 30 patients a day while you're on a palliative care unit, all of which whom are dying, right? For a period of months. Like not going to geriatric homes where like these people are living in just horrible conditions and working at nursing homes in these severely demented units. Like I did not know what I was getting into. And I would say the biggest thing, well, number one, it's like bone crushing, right? It's like bone crushing, life crushing, soul crushing, so depressing. Because again, the amount of exposure to death, I think, is above and beyond. So oftentimes we are exposed to one person in our family, right? Like you have one elderly parent or two elderly parents. You're not seeing 30 patients a day for 2 years, right? Of different people. So the amount of volume that you're seeing of like death and depression from families and what the impact is, I was not prepared for. And I would say, arguably, that's why I'm so vocal and so vocal in the space because I've been there. And, everyone can be in their ivory tower, or you can be like a optimization expert, or all these other things. Or you can look at mechanisms in the lab, and until you're like sitting there and you're like watching these people, watch them with their families take their last breath, and they're talking about the regrets that they've had in their life. I mean, like it's intense. It is intense. So what did I learn? I learned, number one, you don't have room for error. You don't have room to hear all this nonsense in the space. You don't have that kind of time. That window of youth and change closes rapidly. And to be confused and to miss potentially what will move the needle for quality of life forward because of all the noise in the space is it's a mistake. It's a mistake. So yeah. So the biggest things that I learned is there's not time for all this nonsense that goes around. It's not time to cut out protein. There's not time to, forego exercise. And all this stuff is not right. Like it's not right. And then the other thing is don't have regrets. Do the things that you want to do.
You've touched on that regret piece a couple times there. One, how it affected you, but also, working with these people at the end of life, their
Yeah.
regrets. There's this common post that I've seen a number of times on the internet of top regrets of people dying. From your experience, what are some of the top things people were regretting? So hopefully we can use that and work back and use that to facilitate how we're spending our time and energy.
Yeah. I mean, I would say there was like two big things. It was number one, people felt like they wished they had had better relationships. It was about the relationships with their family and their friends. And then the other, and it was a lot about kids, right? Like, and the other thing was, like there's this one woman, she died of heart disease, and she was like, I'm ready. And I just wish that my family would be as ready as me, So I don't know, it's not really regret, but I think that preparing, that understanding that it's really fragile and really short, you know.
And correct me if I'm wrong, you talked about how having that experience was a lever for you to get
Yeah.
your message out there publicly.
Well, yeah. So I see all these people arguing in the middle, right? Like, do you think I really want to talk about protein anymore? No.
Probably not, but
I've been talking about this for 8 years,
yeah.
right? I mean, like, do I do. But do you think that a part of me is like, I don't want to talk about the environmental argument. I mean, the environmental argument, like all this vegan vegetarianism, like at some point it's all ridiculous. It's ridiculous in the way that people don't have the wisdom to understand that this narrative, it doesn't affect, like, who is it affecting, right? Does it affect the 20-year-old, I don't know, in LA or, in a coast? Maybe, but they can recover. The problem is when these blanket statements of reduced dietary protein come out, the unintended consequences to the older population, it's devastating. The unintended consequences of the silly influencer post, they're devastating consequences. And that's why I do what I do. Is I do what I do because if you have a capacity to protect people, you have an obligation to do it. I have an obligation to do it. Can you imagine? I couldn't live with myself if I just sat there and I knew that, environmental veganism is a smokescreen for big companies where we're all fighting amongst ourselves or doing whatever they want. I couldn't live with myself. So I do it because I want to fight for the people in the middle that are confused. I'm a well-trained professional from an extremely reputable institution, trained by one of the world-leading protein experts. If I don't say it and I don't counterbalance the quote longevity experts, then I think that we're going to have devastating consequences. I think that there are going to be devastating consequences. I think that we're going to see a rise in osteoporosis like we've never seen before with these younger women. I feel like these older individuals that are hearing this restrict dietary protein, I think we're going to see an exponential increase in falls and sarcopenia. It's not the right thing to do. So do I want to talk about protein? I mean, the truth is I love the topic, but would I be spending the time after Thanksgiving, which most people are not working, to do this, to get the message out there? I think that if it was a more balanced conversation, I'd probably take the day off.
Well, Gabrielle, I'm glad you didn't, because this was a very powerful conversation. We covered a lot, hopefully a lot, and I feel like we did that you haven't talked about on other shows. And yeah, no, just a very powerful conversation. Again, coming back to the piece where you don't necessarily want to talk about it, but I think this is important.
I'm joking.
No. This is something I think you touched on quickly and said you didn't want to talk about the vegan piece. Yeah. But I have you for a few more minutes, and I think this is a good place to close, because there may be, and I'm guessing there probably is, a group of people that are tuning in right now that are avoiding animal protein. And we've already stressed the importance of animal protein and the difference of the quality between that and plant protein. So for somebody who is holding on to that veganism because of, say, the environmental or the ethics, and obviously the ethics is something you can't really say a lot about, but let's talk about the environmental piece, because people might be using that as a reason not to eat these quality proteins. So talk about why that isn't something they should hold on to.
So the ethical piece, I completely can understand. So I was like almost vegan for a very long time. And it was for an ethical piece, right? But I ultimately got really sick. My hair fell out, like my dentition was terrible. And I couldn't sustain it. And I remember the first time I ate chicken, I was like, it was in my 20s after I had been really close to vegan for a couple years, like 3 years, I was like crying. It was very emotional. So from an ethical standpoint, I don't anticipate anyone needs to change, right? Like I would never ask someone to change their ethics. From an environmental standpoint, if you are not eating meat because you believe it is bad for the environment, you have been grossly misinformed. You are not going to eat your way out of climate change. Nobody is. The climate change issues that are happening are population-based. They're transportation, electricity, and industry. Perhaps the better question is why the big smoke screens? This is not a food conversation, right? You would have to go vegan for 2 years to make up for one transatlantic flight. Okay, so the environmental piece for veganism, vegetarianism is not where the attention should be. If we really care about the planet, don't waste food. Carpool, limit your flights, turn off your electricity. There's many other ways to impact it than further destroying people's health, right? And it just doesn't make sense. And you can look at some of these climate change experts like Frank Mitloehner at UC Davis. There's, it's a smokescreen. The climate change conversation for nutrition is a smokescreen. And I just really hope that, there's this crazy thing that happens when we become biased. We end up having very circular arguments and circular reasoning. And if someone presents evidence of something different and an individual continues to circle back because of their belief, you have to question, why are you so tied to this? Why is one person so tied to this? So I suggest people be very open-minded and question, where is this information coming from and why do they think that to be true? Just because something is repeated doesn't mean it's true.
And I think as human beings, when we start to believe something, naturally we're going to take in information. We're going to read the books, watch the documentaries, listen to the podcasts that support that, and continue to reinforce this message that might not be correct. And that's why an important part of me doing the show is interviewing people across the spectrum that eat all different ways, exercise different ways, live a healthy lifestyle through different means, to let people see that there is this total umbrella and you need to experiment as an individual to see what works for you. And you don't want to be closed-minded and pretend like you have it all figured out, because this is this health and wellness space. You need to keep learning, keep exposing yourself to new information. And I'm just glad you came on with your unique perspective and no BS way of putting it out there, because I think it's going to be really effective to get through to people. And Gabrielle, again,
thanks.
Yeah, no, this was amazing. And go ahead and finish your thought there.
Yeah. I just want to mention where people can learn more about me. I believe that these transparent conversations are critical to knowledge. And I would say in the academic space and in the scholarly space, we all have transparent conversations. Whether we agree or disagree, we tend to, with high intellectual integrity, not everybody, but has these transparent conversations. And I have a podcast called The Dr. Gabrielle Lyon Show, where I interview experts that, again, I realize that this message may be too intense for some people, but that's okay. It's not about pandering to whatever is regurgitated, but really coming with a fresh perspective. And if the ultimate goal is making the lives of people better, then we have to come together to figure out what that is, right? So they can find me at the Dr. Gabrielle Lyon Show. I have a YouTube and a website and a great newsletter that they can sign up for free. And I'm very active on Instagram and Twitter and all the other places.
Well, it's all going to be linked up in the show notes. Really enjoyed this.
I have a book coming out, actually. So
and that is, what is it, September 2023?
Yep. And I have a pre-sale that goes on February 2023. And if people get the book in the pre-sale, there will be some special surprises that only you guys will get. And so that's really cool. And so pre-sale, and then the book Forever Strong comes out September 2023.
Perfect. Excited about the book. Maybe we can do this again when the book comes out, discuss what's in there. And Gabrielle, again, really enjoyed the conversation. Really enjoy what you're putting out to the world. And it's just really important. So thank you.
Thank you so much.
Now that you're done my conversation with Gabrielle, you're going to want to stick around here and catch my chat with Stan. He's got a lot more to share about muscle building that's going to complement what you just learned. I'll see you over there.
Oranges are very high on the satiety index, as are potatoes. To be honest, boiled potatoes I have in all of my weight loss clients' diets because they're really